What is alopecia? Alopecia refers to hair loss from the scalp or other parts of the body. While it may seem like a purely cosmetic issue, alopecia can significantly impact mental health and overall well-being. It is a condition that transcends age, gender, and culture, affecting millions worldwide. Hair plays a vital role in human culture and psychology. From styling choices that reflect personal identity to traditional and cultural rituals that emphasize hair's significance, its loss can lead to emotional struggles, societal stigma, and self-esteem issues. Why does hair loss happen? Hair loss in alopecia occurs due to several reasons, including genetic predisposition, autoimmune responses, or external damage. But to truly understand alopecia, we need to delve into the biology of hair. The hair growth cycle. Explained further. Hair growth follows a natural cycle consisting of 3 main stages. 1. Anagen phase, growth phase. Active growth occurs during this phase, lasts between 2 to 7 years. About 85% of hair follicles are in this phase at any given time. 2nd, catagen phase, transition phase. A brief period lasting 2 to 3 weeks where the hair follicle shrinks. The hair detaches from the blood supply but remains in place. 3rd, telogen phase, resting phase. Hair follicles rest for 2 to 4 months. At the end of this phase, old hairs are shed and new ones grow in their place. In alopecia, this cycle is disrupted. For instance, in telogen effluvium, hair enters the resting phase prematurely, causing excessive shedding. 2. Types of alopecia with real-life scenarios. Alopecia manifests in several forms, each unique in its cause, symptoms, and progression. Here's a more detailed exploration of the common types. 2. 1. Alopecia areata, the autoimmune enigma. Description: an autoimmune disorder where the immune system mistakenly attacks healthy hair follicles. Symptoms: sudden round patches of baldness, often the size of a coin. These patches may spread over time. Progression: it can develop into the alopecia totalis, complete scalp hair loss, or alopecia universalis, loss of all body hair. Example: a 30-year-old teacher begins noticing small bald patches after a stressful life event, eventually leading to full scalp hair loss. 2. Androgenetic alopecia, the most common form. Common names: male or female pattern baldness. Prevalence: affects approximately 50 million men and 30 million women in the US alone. Symptoms: men, receding hairline and baldness on the crown. Women, diffuse thinning, especially on the crown and parting line. Causes: genetic predisposition and sensitivity to dihydrotestosterone, DHT. Example: a man in his 40s starts experiencing a thinning hairline, following the same pattern as his father. 2.3. Scarring alopecia, the irreversible type. Description: permanent hair loss caused by inflammation that destroys hair follicles and replaces them with scar tissue. Symptoms: red, inflamed patches with noticeable scaling. Causes: autoimmune conditions like lupus, severe infections or burns. Example: a woman with lupus experiences scarring alopecia after a flare-up, resulting in permanent bald spots. 2.4. Telogen effluvium, stress-induced shedding. Description: temporary hair loss triggered by significant stress or physical changes. Symptoms: hair falls out in clumps during brushing or washing. A noticeable decrease in overall hair volume. Causes: childbirth, surgery, severe illness, or emotional trauma. Example: A new mother notices excessive hair shedding 3 months postpartum, a condition known as postpartum hair loss. Traction alopecia, the preventable type. Description: hair loss caused by prolonged tension on hair follicles due to tight hairstyles. Symptoms: gradual thinning along the hairline or in areas under constant strain. Prevention. Tips: avoid tight hairstyles like braids, ponytails, or buns. Opt for looser styles and give your scalp regular breaks. Emerging and rare types of alopecia. Frontal fibrosing. Alopecia, a form of scarring. Alopecia, affecting the hairline and eyebrows. Alopecia barbae, specific to beard hair loss. Diffuse. Alopecia. General thinning across the entire scalp, often linked to medical conditions or deficiencies. Who is affected by alopecia? Prevalence and demographics. Hair loss knows no boundaries. It affects people across all demographics. Global statistics. Alopecia areata affects 2% of the global population. Androgenetic alopecia, 50% of men by age 50, 40% of women by age 50. Scarring. Alopecia accounts for approximately 3% of all alopecia cases. Impact on women. Although hair loss is often associated with men, it has a unique and profound impact on women due to societal beauty standards. Studies show that women are more likely to experience emotional distress and reduced self-esteem compared to men facing similar conditions. Children and alopecia. Children are not immune to hair loss, particularly with conditions like alopecia areata or tinea capitis, a fungal infection. Losing hair at a young age can result in bullying, social withdrawal, and anxiety. Namaru Uras. 4. Emotional and psychological impact of alopecia. 1. The mental health connection. Hair loss can lead to feelings of helplessness, embarrassment, and even depression. Individuals may avoid social situations or public outings due to fear of judgment or ridicule. 4.2. Overcoming the stigma. Society plays a significant role in shaping perceptions of alopecia. Educating the public and normalizing hair loss can help individuals regain confidence and live fulfilling lives. 4.3. Real-life stories. Story 1. A young woman with alopecia areata shares her journey of self-acceptance after years of hiding her condition. Story 2. A man with androgenetic alopecia turns his baldness into a personal brand, inspiring others to embrace their appearance. 5. Importance of seeking help early. Early diagnosis is crucial in managing alopecia. The earlier a person consults a healthcare professional, the more options they have for treatment and lifestyle adjustments. How to approach a doctor. 1. Keep a record of hair loss patterns, symptoms, and possible triggers. 2. Ask for specific tests to rule out underlying conditions like thyroid dysfunction or nutritional deficiencies. 6. Supporting those with alopecia. If you know someone with alopecia, offer them understanding and compassion. Avoid making unsolicited comments about their appearance and instead, educate yourself on the condition to provide informed support. Conclusion. Expanded. Alopecia is more than just hair loss. It is a journey that affects every aspect of a person's life. Through understanding, education, and support, we can create a world where individuals with alopecia feel empowered and embraced. What's next? In the next section, we'll explore treatment options, lifestyle adjustments, and innovative therapies that can help individuals manage alopecia effectively.